Welcome to the Moon Collective Sanctuary. I'm Dr. Lydia Luna, and I invite you to join me on a journey of self-discovery, healing, and transformation as we explore the depths of our inner and outer world to unlock our truest potential. Welcome, everybody, to the Moon Collective Sanctuary podcast. My name is Dr. Lydia Luna, a licensed clinical psychologist and founder of the Moon Collective Sanctuary. And today I'm joined by Dr. Marc Smith, a board-certified psychiatrist who's at the forefront of psychedelic mental health treatment. He's also the founder of Clear Ketamine Psychiatry in Westlake Village, California. Thank you so much for joining me today. We're so happy to have you.
Thank you for having me. It's so nice to be here.
Yes. So today we're going to talk about ketamine-assisted psychotherapy.
Yes.
So I'd love for you to first share a little bit about yourself and what led you to working with ketamine.
Sure. Yeah. Where to begin? So I have kind of a circuitous path to medicine. I believe it or not, after college, I worked in the financial industry for 3 years. Really was looking for something else, something more out of my life, out of my career. So I went back to school to do all the pre-medical undergraduate prerequisites while working, and then eventually went to medical school back in New York at Columbia University. Went to residency here in LA at USC in psychiatry. So when I went to med school, I didn't quite know that I wanted to be a psychiatrist. I learned that there. I really fell in love with it. Not only was I fascinated by the brain and how that's connected to thoughts and emotions and just the human experience, but it really is the branch of medicine that you get to form direct human connections.
That's true.
The strongest way. And I was really drawn to that. And as I kind of went throughout all the steps that it takes to become a board certified psychiatrist, you do 4 years of med school, 4 years of residency. And I trained in every single type of setting in psychiatry. So inpatient, outpatient, with children, adults, older people. And I found that obviously I believe in medications, right? They're really effective for so many people. And they save lives. But at the end of the day, there is a large portion of people that traditional psychiatric treatments don't help, right? They have medications have side effects. Sometimes there's just people that are called treatment resistant, right? So they try medications, they just don't help them. And, they take a while to work as well. SSRIs and medications like that can take 4 to 6 weeks to even start having an effect. So I was really interested in newer types of treatments that could help that large portion of patients that medications and therapy didn't quite help. And luckily, when I was training was a really fertile time in terms of new treatments. Mm-hmm. There was a lot of new, we call them interventional treatments, right? So one of those was ketamine and esketamine, which is a derivative of ketamine, also called Spravato. And another one is TMS. And there's all sorts of newer psychedelics being studied right now. But yeah, so I kind of took an interest in that during residency, finished residency, worked in group private practice professionally, learning the intricacies of the treatments. I trained in TMS and ketamine and Spravato as well. Saw a lot of patients in all those modalities and really saw how it changes lives. And it's just something that really fascinated me and really inspired me. So about 6 months ago, I decided to open my own practice out here in Westlake.
That's awesome.
Thanks.
Yes, congrats.
And I really was motivated to do that because just the model of kind of insurance-based psychiatric care, I didn't quite feel like I was doing the type of work and providing the type of service that I really believed in most. A lot of it is kind of short appointments, many back to back throughout the day, just enough time to kind of tweak medications and see you later. And in my practice, I really take a personalized, holistic approach to try to talk about all the different aspects of patients' lives, medications, therapy, lifestyle factors like
Yeah.
exercise, sleep, diet, mindfulness, and of course, interventional treatments where applicable, like ketamine-assisted psychotherapy. So
Yeah.
that's kind of the I don't know if it's a long story short or a short
Yeah.
story long. And
But it's pretty exceptional that you noticed the deficiencies or shortcomings of a certain model and you decided to venture out and do your own thing where you can provide exactly what you want and know is needed.
Yeah, thanks. Yeah, no, for me, it's I made such a dramatic shift in my life and career that I'm really focused on doing what feels like I'm a being of service and really connected. So whatever that is, I'm going to keep following it, keep doing it.
That's
Yeah.
right. So maybe we can get started
Sure,
to talk
absolutely.
about what is ketamine and ketamine-assisted psychotherapy.
Yeah, I'd love to. A lot of people have heard about ketamine, right? It's in the
Yeah.
news. You might have heard it in a lot of different
And
contexts.
sometimes I like when it comes out in the news, it has a negative
Hmm.
connotation.
Hmm.
So maybe we can also dive into these misconceptions too.
Yes, I'd love to. Because that's something that I think there are a lot of misconceptions about
Mhm.
ketamine and how it's used in the appropriate clinical setting as
Yeah,
opposed to how other people may have heard that it's
right.
used. So, ketamine is a dissociative anesthetic. It was originally developed in the 1970s as a medication that was used for anesthesia and surgeries or other medical procedures. And it was used in that way for many years, approved by the FDA for that purpose. And they found over time that actually a lot of patients who received it, there were a lot of other benefits. For instance, they would wake up from the procedures or come out of the procedures just feeling a lot better. So they did clinical studies, which actually showed that it has a profound ability to rapidly improve symptoms of a variety of mental health disorders. Most studied is depression, right, and suicidal thoughts very, very quickly. How it works is I get a lot of questions about the science about it. So
Mm.
it's an NMDA receptor antagonist. I'll just kind of go into some of the science
Yeah,
of it.
yeah.
And it has a lot of complex interactions on nerve cells in the brain. But ultimately, what it does is it increases uh, a, a molecule called BDNF, right? So that is a growth factor which stimulates nerve cells to form new connections in a lot
Amazing.
of different parts of the central nervous system, but most notably the prefrontal cortex, right? So it what that really means, we call that neuroplasticity. So what that really means is the brain has when during and after ketamine, it puts the brain into a state where it can form new connections that weren't there before. So, I mean, this really helps people get out of rigid kind of
Yes.
mental thought loops that they're not otherwise able to. When used in a therapeutic context, it's it re- as I mentioned before, it really rapidly resolves mental health symptoms and it can cause profound change very quickly.
It's pretty powerful, right? When people, especially when they say, I feel stuck, nothing is working for me, to know that this exists.
Yeah. Yeah, absolutely. And so there's kind of a dual aspect to ketamine treatment.
Hmm.
And so a lot of the studies that have been done have been just giving ketamine through IV and a certain number of sessions. That alone improves a lot in terms of
Hmm.
depression, anxiety, PTSD. But when paired with therapy, right? So we call
Hmm.
it CAP, KAP, ketamine assisted psychotherapy. It really allows patients to explore deeper emotional material, um, loosen stuck narratives that they may have, and process trauma from a place of expanded awareness and access different perspectives and insights that they wouldn't have otherwise have. So it's the most powerful when combined with therapy. And there's some discussion in the community whether the experience itself, how much of a factor that is. And in my opinion, it's a huge factor, right? Because it does work even without really doing much of anything else, but it really kind of amplifies the results when it's done with therapy.
Right.
So yeah, they're actually studying forms of ketamine that, like, derivatives of the molecule that are able to induce the neuroplasticity without the dissociative kind of psychedelic like experience. Yeah.
Yeah. So I became familiar with ketamine and ketamine-assisted psychotherapy because I saw such a profound shift in my consciousness and my healing work when I had an ayahuasca journey. And I mean, I thought, wow, everybody should do ayahuasca, but I know it's not the case, and not everybody should do ayahuasca, by the way. But it led me to this awareness of psychedelics and the power to heal and expand consciousness, bring different kind of awareness and perspective to life and our past and traumas. And so obviously that's not legal right now. But it led me to this place of ketamine, and this is a legal medication that people can experience. And so I decided, okay, I want to explore this more. I had training, and it included an experiential component, and it was beautiful. It was profound, and it really made me believe in the powerful healing aspect of it. And so now I incorporated it in my practice, and I really have seen the value that it has on people. I've had a client who was suicidal when she came in to do this work. And after the first session, her perspective shifted, and I was like, this is amazing. This has so much potential. And not to say that everybody is going to experience the same outcomes, but I really did see how beneficial this is. And it's still relatively new, so not a lot of people know about this, which is why I was so excited to have you here to talk about this and bring awareness into this.
Yeah, no, that's a beautiful experience. Thank you for sharing. Yeah, and it's not uncommon, right? I actually did a ketamine-assisted psychotherapy session myself as well in my training, and it was an extremely powerful experience, and it really helped me gain insight and build even more empathy for what the experience is like and how powerful it can be for patients. So I mean, I wanted to address some of the misconceptions and some of the,
Let's do it.
like I said, stigma and misinformation is something that we're always fighting, right? Everyone's heard about Matthew Perry, of course. And, I could get into that as well. But one thing that is a common misconception is that it's unsafe, right? So ketamine has been used safely in medical contexts for many, many years, right? Over 50 years. And the doses that we use for psychedelic ketamine-assisted psychotherapy are much lower than anesthetic doses or what people use for recreation. And so it's really effective and safe at those doses. In addition to that, when you go to a medical doctor, medical provider, they'll screen you for any possible contraindications or any reason why medically you might not be a good fit, and talk to you about that. And obviously, account for that in your treatment plan. And on top of that, we do really strict monitoring. So for every session, all my patients are monitored, blood pressure, oxygen saturation. We have medications in case anything were to ever go wrong, where the clinic is fully set up for anything that could happen. So knock on wood, I've never had anything at all that happened that was an emergency, and it's really safe actually when done properly in the right medical setting. Another kind of misconception is that it's just like a drug to get high, right? That it's just a party drug, it's a
Yes.
recreational thing. That is true. People have used it for, recreation, for fun at clubs, at raves or whatever, called Special K. But there is a wealth of clinical studies and evidence that when used in a therapeutic setting, it's really not about escapism. It's not about, fun. It's about really using it for its benefit in therapy, right? With clear intent and a supportive environment, it's one of the most powerful tools we have in psychiatry.
Yeah. It's a pretty cool time to exist, I think, with technology and the reconnecting
Yeah.
to psychedelics.
Yeah.
I think this is so cool to merge the two.
Yeah. Yeah. And so just a little bit of more information on that in terms of other psychedelics, right? So ketamine's unique in that it is a legal FDA approved medication, as I mentioned, for anesthesia, which is different than things like psilocybin or LSD or DMT or things like that, because even MDMA, right? Those are currently illegal and they're
Yes.
not approved for any medical
Right.
purpose.
Right.
So to use ketamine and study ketamine is much easier from a regulatory standpoint to study and use off label, right?
Mhm.
So it's not FDA
That's a good point.
approved
Yeah.
for any psychiatric indication.
Right.
We use it what's called off label, which is a common practice for medications. But the derivative of ketamine called esketamine, or the
Mhm.
brand name Spravato, is FDA approved. And a lot of the reason for that is just kind of financial, honestly, because you can't really make too much money off of ketamine because it's not able to be patented. So a lot of, there's no impetus for a pharmaceutical company to pursue that FDA indication. Whereas with something like esketamine or Spravato, it's not the same molecule, so they're able to patent it and sell it for a profit. So
For the listeners, can you share what the difference is between ketamine and esketamine?
yeah, so ketamine is what's called a racemic mixture of two different molecules. It's mirror images. It's R-ketamine and S-ketamine. So S-ketamine, it's spelled Esketamine,
Mhm.
but the chemical molecule is the letter S-ketamine. So it's just the isolated type of one half of the molecule that's in regular ketamine. And it has very similar effects psychiatrically and experientially, and also been proven through rigorous studies to have
Mm.
really powerful benefits for mental health, depression, suicidal thoughts, those kind of things. But that's just the technical difference. Yeah.
Okay.
Oh, just wanted to add one more thing about ketamine, kind of the current landscape and
Yeah.
misconceptions. So, and this is relevant to the Matthew Perry case as well,
Mhm.
right? So it is, as you mentioned, a newer field, right? So there's a lot of different ways that it's done right now. It's not really strictly regulated. So that kind of lends itself to it being provided in a lot of different structures. So everything from they have companies that will just mail people ketamine, and after a brief assessment online without any kind of strict monitoring in a clinic or anything like that, to clinics that kind of just give the medication with no
Yeah.
therapy, to therapists who pair with a medical doctor and kind of do it in that model. There's psychiatrists that do it. There's anesthesiologists that do it. So there's all sorts of different providers, and they range in terms of their level of sticking to the evidence base and safety protocols and therapy provided and how extensive really how much care you receive, right? So it's really important to find a provider and a clinic that does it in the evidence-based way and with the correct protocols. And I would strongly recommend in a ketamine-assisted psychotherapy model. So that's another thing to really keep in mind when thinking about ketamine, that not all clinics are the same.
That's right. And maybe we can highlight the benefits of doing ketamine-assisted psychotherapy and, why that's more beneficial, let's say, or helpful rather than just getting ketamine prescribed and taking it by oneself.
Yeah, absolutely. So ketamine assisted therapy involves preparation therapy sessions and integration therapy sessions separate from the actual administration of the ketamine,
Mhm.
right? So they're really, really important. So the preparation sessions really get you in the right, we call it set and setting, are big keywords for psychedelic assisted therapy. And what that really means is the mindset and the setting in which you do it, right? It's kind of like saying it's not just what you do, it's how you do it, right? And that's really important so that you feel prepared, that you
Mhm.
you have an intention going into it, which you hope to kind of cultivate the mindset, the emotional state, um, the setting in which you do it. That feels like a very healing, calm
Yeah.
setting is very important. And then after the ketamine session, having a space to process what happened, right, and integrate your experience into your healing process and into how what you take with you, right, on a day-to-day
Yeah.
basis, making meaning of what occurred.
Yes.
In addition to that, it's also really important to have a provider present during the session, right? Because it is an altered mind state, and to have a setting that's safe and a person that you feel comfortable with is a very vulnerable state. I can speak from experience. It was
Yeah.
important for me to have a a therapist that I felt safe with, right? And that is able to kind of guide you through it. And so that's another crucial aspect to ketamine assisted psychotherapy. Whereas ketamine treatment is just getting the medication, right? Someone might be monitoring you. You might be monitoring yourself if you do it at home, which I wouldn't recommend. Um, and there's no kind of structure in terms of what place it serves in your healing process, in your therapeutic process.
Okay. How about we focus on the importance of set and setting
Yes,
and
cool.
integration?
Yeah.
Why is that important?
So set and setting is so important because as I mentioned, when you do ketamine
Mhm.
assisted therapy, you're in a very open state, right? We say neuroplasticity,
Mhm.
and that can it's important to harness that, right, and to use it to make positive gains, right, to make positive changes. And so it's kind of like if you have this state and you don't know what to do with it, you don't know where you're going. Um, it doesn't really have its most power, right? Whereas if you have a direction of where you're going, you have someone to guide you through it, and you have you make sense of it, then that can really you harness the power of that plasticity into a positive direction. And really, it's all about improvement and healing, right?
Mhm.
So it's all about getting to where you're trying to go.
I want to share, I think this is such an important understanding that intention matters. Every day,
Mhm,
whatever
mhm,
we're doing, if we bring intention into it, first identify what intention we
mhm,
want to bring into anything we do, it can really shift things around, like our day even. Like, what is my intention for today? Or if the day is moving us in a certain direction, is wait, what do I want the intention to be in this moment? Do I want to get um, affected by life or a situation or people, or is my intention to have a good day? That's going to shift. So I really do believe intention is so important, especially as we're doing these kind of experiences or journeys.
Yeah, absolutely. That's so true. And that's what preparation and integration are all
Yeah.
about, right? And it's about finding your intention, your true intention, not some psychological buzzwordy kind of thing. Like, what are you hoping to
Looking
get out
into
of it?
what our needs are in that
Hmm.
moment. What are we needing? What are we wanting?
Yeah, yeah, and I in one part of um, all psychedelic assisted therapy and definitely ketamine therapy is, I think it's important to avoid kind of like guru culture.
Yeah. Yeah.
And as a medical provider and a therapist and a psychiatrist and a medical doctor, I'm not a guru, right? I look at myself as a support system, right? Walking with the patient through it and supporting them and on their journey rather than, bringing them some sort of salvation or being,
Mhm.
everything that they're looking for and their intention is inside of them, right?
Yes. Great
And
point.
I'm just trying to help them get to that.
Mhm. That's important.
Yeah.
Yeah. And I do notice that too, actually. I have experienced that where people become so open that it's almost like, wow, like, tell me more, show me more. But I love what you're saying. It's almost like empowering them, bringing back the power to themselves to be like, you have everything you need. We're just here to guide the process and walk alongside you.
Absolutely.
Yeah.
Yeah.
So, should we talk more about the integration then? Because with ketamine assisted psychotherapy, it usually is more than one sitting. So, as the work progresses, how do these integration sessions bring in lasting healing and psychological growth?
Sure. Yeah, absolutely. So, an integration, really what the session is kind of like is starting by debriefing, what came up. So a lot can come up during a ketamine session. That's emotional, thoughts, visions, sensations.
Mhm.
And so we ask, what came up? How did that make you feel? What emotions were associated with that? What's the meaning of that to you? Is there anything that you can make sense of any of that? Is it
Mhm.
connected, And how can we anchor this to your daily life? Like what taking from this meaning, taking from what you experienced, how can we apply that to your day-to-day life, right? And so a lot of things I also do with patients and is recommended is to like pair it with other types of support, ongoing support. So I always recommend patients do journaling throughout the experience. They write down their intentions. They keep it with them on a piece of paper. We practice grounding techniques, breathing techniques, things like that. Um, and I give all my patients healthy habits to help support ketamine therapy. So it's diet, exercise, sleep
Yes.
hygiene, engaging with positive material. And like I
Yeah.
said, when you're really open, it's important to kind of engage with things that feed you, right?
That's right.
Inspire you. Um, and the right supplements if you need to take them. Really anything that's going to support your physical and mental health on an ongoing basis. And then on an ongoing basis, I really always recommend that patients take after ketamine therapy, you take another look at um, your medication regimen, your ongoing therapy. I always recommend people continue to see a therapist because it really helps focus on how these new insights can apply to their personal relationships.
Mhm.
It can apply to their behaviors, their concept of self on an ongoing basis. So, um, I hope I answered the question. Does
Yeah,
that make
yeah,
sense?
and I think what's so cool is, like, it's an opportunity to create new belief systems, right? I even found that affirmations are so helpful during this, integration process because we want to like, if we can imagine that the slate has been wiped clean and now we have an opportunity for new pathways of self-beliefs or thoughts or how we perceive the world. Like this is prime time to do that.
Yeah. And, you know, true healing is really not just symptomatic relief, right? We give scales, we look at, how depressed are you feeling,
Mm-hmm.
that kind of thing. But it's really when there's a shift in how people see themselves, how they see their past and their future, right?
Mm-hmm.
And we want people to thrive,
Yes,
right? Not just survive.
that's right. I love that. Can you share about a transformative experience that you've had with a client that really illustrates the transformation this medicine can make?
Yeah. Yeah. I mean, it's when I think about my patients that I've seen really transform their lives, I mean, that's when I become the most grateful. I am so grateful to be able to do this work. Um, and I'm always humbled by how inspiring it is to witness this type of transformation. But yeah, there's one particular patient in mind. She was a young woman who had really long-standing depression, um, was really disconnected emotionally, disconnected relationally from her family, her friends, her work. Um, tried every medication you can imagine,
Mhm.
went from multiple psychiatrists to psychiatrist, and nothing just ever seemed to work. There were side effects. There were partial benefit at times from medication and therapy and life circumstances changing, but nothing ever was really fully helping.
Mhm.
And she found herself in really a really bad place, right? Um, so, people hear about ketamine and they come and they're a little skeptical at first usually and, want to have a lot of questions. And so, we answered all those questions. We set up a plan. So a typical course for ketamine assisted therapy is 6 treatments over the course of 3 weeks. So like twice a week. Um, and then that's just the ketamine treatments. And then, as I mentioned, there's therapy before sessions, therapy after sessions. So, and after the first session, it was like this heavy, dark cloud was just removed, is how she described it. Like she went home. I always recommend people take it easy after, and but she said it was like a weight was just relieved from her shoulders, right? She was able to let her shoulders down. And as we continued going, I saw kind of light come back to her, smiling and having more inspiration and really thinking about her future and reconnecting with her passion at work. It was like bringing her back to life.
Mhm.
And for a lot of people, that's what they say, right? It gave me life again. And so, this is this is why it's so important to me and why it's so meaningful to me is, people kind of write it off a lot of times or make jokes or like, you know, don't fully understand the power of ketamine, but when you see these types of
Yes.
transformations, you really take it seriously and, it's worth it. It's worth kind of pursuing kind of the gray area that it
Yeah.
is to fight the stigma to do it all. So, yeah.
Are there any ethical considerations that practitioners or patients should keep in mind as they're thinking about maybe experiencing ketamine or ketamine assisted psychotherapy?
Yeah, absolutely. It's an important question, right? Because yeah, it is potentially a drug of abuse, of diversion. It's similar to, opiates and benzodiazepines when used in the right context, they have their medical use, but they can be misused too, right? Adderall, things like that. So it's really important to keep that in mind, right? One thing is to do a full evaluation, right? Screening,
Yeah.
of the patient. Make sure that, there's no history of ketamine abuse, that it could trigger substance abuse. Actually, when used with support and for the right patients, it actually can be effective for substance abuse problems, but that's a very tricky area, right? You have to make sure that it's not going to trigger further substance use,
Mm-hmm.
right? So, but the way that I do it and the way that my clinic does it is we don't give take home doses. Like you have to come into the clinic, we administer in the clinic
Yeah.
ourselves, right? So that's important. Informed consent, right? It's all about informed consent from a medical ethics standpoint. What that really means is making sure the patient knows everything. You know the risks, you know what it's for, what it can do, what it can't do, what your alternative options are, what the side effects are, and really, you know, everything before getting into it, right?
Mm-hmm.
So that's important part of an ethical approach, and I try to always make sure my patients there's no stone left unturned.
Yeah.
They know what they're getting into for sure. Monitoring, right? So that's the concern that I have for these kind of at-home treatments is that there's really no monitoring that it would meet medical criteria, right? So it's really important to be monitored both from a medical standpoint and a psychological psychiatric standpoint and have support, right? So that's an important part of ethics and making sure we're using ketamine for the appropriate indications, right? It it's used to help people who are struggling, right? Psychiatrically. It's not used for fun, right?
Mm-hmm.
I if people come to me and just want to, try it for fun, you got to turn them away, right?
Yeah.
And explain what it's really for.
Right.
So those are kind of some really important
Yeah.
ethical considerations. And you do see, and coming back to the Matthew Perry case, right? There were a lot of unethical medical providers who were really just selling the ketamine for profit, and that can be really dangerous, as we saw. Right? There was no screening, there was not the right dosing, there was no um, supervision and oversight, and a lot of those providers are now facing legal consequences for that. And so, yeah, it's really important for patients out there to find the right provider, right? A reputable
Mm-hmm.
person who might be a member of societies like the American Society of Ketamine Physicians, or it just is well known in the community and really does things the right way.
What about contraindications?
Mm-hmm.
Is there anyone that maybe wouldn't be a good candidate for ketamine?
So there's absolute contraindications, meaning if you have these things, you can't get it, and there's relative, which means you can get it. You may or may not be able to get it. We might have to do some more medical workup and keep an eye on things. So a couple absolute contraindications. So unstable heart disease. Ketamine can put pressure on the heart and the cardiovascular system. It increases blood pressure during treatment, increases heart rate. So if you have underlying heart disease that's not controlled, you can't get ketamine treatments. Now, if you have something like stable coronary artery disease or stable hypertension, then you could still do it. We just might need clearance from a cardiologist, someone that you're seeing, to make sure you're checked out and okay. So other types of disorders that have cardiovascular disorders, things like if you have had an aneurysm of some sort, if you have increased intracranial hypertension, meaning high blood pressure inside the skull. If you have glaucoma, that's increased pressure in the eye, so it can increase that blood pressure as well and cause problems there. People who have a history of schizophrenia, psychosis, or acute manic episode, which is part of bipolar disorder, you can't get it then. But if for bipolar patients who are depressed, they can get it. It's just when they're on that high phase of bipolar. And then obviously, if you've had an allergy to ketamine, it's very, very rare, but people have had allergies. So we always monitor that as well. A couple other relative contraindications. So kidney disease, some of the metabolites are processed through the kidneys. So liver disease, we also want to be cautious with that. And as I mentioned, substance use before. So if someone's actively engaged in their substance use, it's not a good idea.
Mm-hmm.
But if, say, they've struggled with substance use, they have a plan, a structure, a treatment team in place, and it's used in a therapeutic context to help with their recovery,
Mm-hmm.
that's actually been shown to be really helpful in certain types of substance use, specifically alcohol and opiates.
And I think we talked about it a little bit in the beginning, but who would this be good for? We talked about
Yeah.
treatment-resistant depression,
Mm-hmm.
and we know PTSD,
Mm-hmm.
anxiety.
Yes. So there's varying levels of literature and studies and evidence on different disorders.
Mm-hmm.
So the strongest by far is treatment resistant depression. So people who have depression, who have tried medications. The other strongest is suicidal thoughts, right? So it's really helpful to quickly treat suicidal thoughts and help people get out of that suicidal place. And so a proposed model of care, which could be really effective treatment, is as it takes a while for medications to kick in, like SSRIs, 4 to 6 weeks, which are traditional antidepressants, using ketamine first within that time to kind of get a catalyst to feeling better, get out of the suicidal thoughts, get out of the depression, and then the medications kick in. So it's more of a longer term plan. And obviously therapy too, right? It doesn't work overnight to kind of get that plan in place and establish long term follow up. So depression, suicidal thoughts, PTSD, there's pretty good evidence for certain types of anxiety, including generalized anxiety, social anxiety. And there's emerging literature on other things like OCD even. So, one other thing that has been found to be really helpful for is end of life distress, right? So people who have, a terminal illness, might be on hospice, are facing these really big questions about life and
Mm-hmm.
existence and can get people into a place of feeling really dismal, right?
Mm-hmm.
It really helps those people actually um, be at peace toward the end of their life. And so that's another kind of indication that we found that it can be helpful
Mm-hmm.
for as well.
What a great resource for those that are maybe facing end of life to know that this is out there for them too.
Yeah.
Yeah. Well, I'm curious, as we're approaching the end of us talking, is there a message that you want to give to listeners? It could be like what this medicine has taught you, or just a message for them in general.
Yeah. Yeah. Thanks for asking. So, you know, in general, I would say to patients that are struggling, don't give up hope, right?
Mm-hmm.
There are things that can help, even if you haven't found it yet. And, every patient reminds me that transformation is possible.
Yes,
And even when it seemed unreachable, healing isn't linear, right?
that's right.
Sometimes the process can look messy, it can look unclear, and breakthroughs often come from really unexpected places.
Yes.
Reach out, explore different options, explore the different tools. I always say ketamine, medications, therapy, TMS, lifestyle, diet, exercise. They're all just tools in the toolbox. And the tool that's going to be right for one person might not be right for another person. And so we need to just find the right tools that work for you. And so there are more tools now. Ketamine is one of those tools. And
Mm-hmm.
if if you've tried the other tools and they haven't worked, it might be right for you. So, yeah.
So don't give up hope.
Don't give up hope.
Yeah, I love that. Where can people find you?
So you can find me most easily at my website, www.clearketapsych.com. That's ClearKetapsych.com. I'm on Instagram. My handle is at Marc Smith MD. It's Marc with a C. And my practice Instagram is at Clear Ketamine Psych as well.
Awesome. Well, I do hope somebody reaches out if they're curious about this and want to work with somebody who takes a holistic approach.
Yeah,
That's
thank
wonderful.
you. Yeah, it's
Well,
been a pleasure being here, and thank you so
Yeah.
much for creating the space to have discussions like this, and for inviting me. I really appreciate it.
Yes.
Yeah,
Well, thanks again. I hope to see you back so we can talk about maybe TMS and these other offerings that you have in your practice.
absolutely.
Yeah. All right. Well,
Thanks.
thank you so much.
All right.
And thank you guys. And I'll see you next time. Take care. Thank you for joining me on the Moon Collective Sanctuary. Remember, your journey to a more fulfilling and empowered life continues beyond this episode. Until next time, may you remember who you are and stay open to embrace all that life has to offer. Continue your personal transformation beyond this podcast. Explore our range of healing services and upcoming events at mooncollectivesanctuary.com.